USA.com to apply for the money you need.
Sky 3, coverage from breathtaking angles.
If you are an athlete, perhaps you have a child in school, maybe you're just a weekend warrior runner, whatever it is, you want to perform your sport to your best level, and surgery can certainly sidetrack you very quickly. So it's great for us this morning to have a conversation with Amy Ketron. She is with the Center for Sports Medicine, very proudly talking about a new offering they have called performance therapy. Good to see you this morning.
Hi, good morning.
I'm glad to talk to you about this because you were kind of educating me before the conversation got going that even when you're just working out, the exercise can cause a little bit of inflammation, if you will, within your body, but surgery can really cause a setback for athletes.
It can. And while we don't want surgery for anyone, our goal at C4 is to treat the whole person. And we're really known for our rehab and physical therapy that we do here for athletes when they have an injury. But what's great is that we treat you before you even have an injury. I think a lot of athletes don't even know that they need to be taking care of some of these inflammation or soreness issues all along the way as a weekly.
So is that what the performance therapy does? It addresses things on the front end, not the back end?
Yes, on the front end.
Okay. So how does it work? Because I know that surgery is not your first line of defense either, or offense. You know, you hope to put that off for people if you can. But if somebody comes in and they've got a problematic knee and they end up needing knee surgery, what are you going to do with them in this performance therapy?
So with that person at C4, we're going to bring them in at the end, you know, obviously after surgery, and your typical physical therapy, things right after surgery. But there are things we do here at C4, cupping, scraping, compression boots and sleeves that help relieve inflammation and pain after surgery.
Okay, so is this something, Amy, that y'all have kind of developed on your own there at Center for Sports, or is this something being done nationwide? You're just the first to bring it to Chattanooga?
It is being done nationwide. There is a train of thought right now spreading throughout the athletic training population, those that take care of athletes and their injuries on a daily basis, that says we take what we would typically do in physical therapy and do it with the athlete before they're injured. Treat the person after they work out as if they have an injury, and that helps them recover so that they can perform at their next workout at their optimal level.
So, you know, there are plenty of people, even 10 or 15 years ago, that would have thought, okay, that's great. I always see folks running across the bridges in town, but what kind of athletic hub are we really here in Chattanooga? Look around you. We've got CFC, we've got the Red Wolves, we've got the Lookouts, you've got the UTC players. I'm sure that the waiting room is full quite often with local athletes needing your help.
It's true. We've also got those that went to high school here and have gone off to college and come back for the summer. We have those that call us and say, hey, we're just in town for a weekend. Can you help us out? The gamut really runs from those that are playing in high school, middle school here in town, all the way through collegiate, athletic, pro, and then weekend warriors, like you said.
So kind of walk me through this, because I'm still having a hard time understanding if I'm the patient, right? And let's say I'm a tennis player and I'm having that typical, I'll go with the obvious, elbow problem. So I'm going to come to you first to say, work me through my issue. And if the decision is made that surgery is what I need, do I need to ask for this type of therapy prior to surgery? Will y'all automatically put me there, and does insurance cover it?
You can absolutely ask your doctor about it. That word needs to spread within the physician population. They probably are not going to know yet to offer this to you. They're going to say, do your typical ice compression elevation type thing that you would normally advise. So we are trying to educate patients and athletes that you need to do this and seek it out on the proactive and offensive side.
Okay, and does insurance cover it, Amy?
It does not.
Okay.
We have had success. It is a cash-based service. However, we have had success with people being able to submit receipts to their FSA and getting reimbursed for it, since it is a medical type procedure, similar to massages, things like that.
Okay.
Of course, people would need to follow the rules of their insurance and things like that. However, our service is cash-based.
And I'm not trying to hold your feet to the fire, but I've got you, so I want to take advantage of you while you're here. I guess it's a case-by-case basis, but do most people need, I mean, is there typical like 6 sessions prior to surgery, or is there kind of an average that people can expect to fall into?
Yeah, I would say 2 a week.
Okay.
Is a good place to land. Most people kind of after their injury are gonna end up, if they need surgery, about 2 weeks after their injury is the timeline. So somewhere in the 4 to 6 visit range before surgery.
Okay, and then that's where the conversation comes in, because again, it's a case-by-case basis. For some people, the preventive side might be more beneficial on the back end than others. Might also depend on how quickly you're needing to recover. There's a lot of gray area there, I would think.
There is. We also offer some a membership here. So these is for that offering is for those that maybe don't even have an injury, right? But they're saying, I want a full membership to come in and see you anytime I work out. I come in after my workout and get my inflammation and get my soreness, stiffness taken care of, and then I go back to my next workout tomorrow. And you can utilize those visits in your membership at any point whenever it's convenient for you.
You know, I've heard that said so many times before that it's great to have your 30 or 40 minutes of cardio. That's fantastic, but it's the stretching on the front end and the back end that will keep you protected.
It is. We recommend dynamic stretching to warm up, so movement, and then the slow and steady hold on the back end of your workout. Doing that before your workout actually can prevent some strength. So moving, stretching before, slow and steady holds at the end.
All right. Well, Amy, thank you so much for your time this morning, and no surprise that y'all will be the ones bringing this here to Chattanooga. Great to talk to you.
Thank you so much.